L Cavey, National ERISA Disability Attorney. Welcome to Winning Isn't Easy. Before I get started today, I want to give you a legal disclaimer. The Florida Bar says I have to tell you that this podcast is not legal advice, but nothing will ever prevent me from giving you an easy-to-understand overview of the disability insurance world, the games that disability carriers play, and what you need to know to get the disability benefits you deserve. So off we go with this episode. Over the last several weeks, I've been talking about the application process, what you need to know, the work history forms that you are going to be asked to complete, the activities of daily living forms that you have to fill out, and the attending physician statement form that your doctors have got to fill out. Now, I'm going to talk today about 3 more things you need to know about the disability insurance claims process. And we've talked about and touched on a little bit of this in our last episode. But today, it's the medical issues, regular care of doctor issues that I think are important for you to understand. So I'm going to talk about the requirement that you be under the regular care of a doctor, the consequences of irregular medical care or no medical care, and the role of your physician in your disability claim. Let's take a break before we get started. Look forward to seeing you in a minute.
Have you been robbed of your peace of mind from your disability insurance carrier? You owe it to yourself to get a copy of Robbed of Your Peace of Mind, which provides you with everything you need to know about the long-term disability claim process. Request your free copy of the book at caveylaw.com today.
Welcome back to Winning Isn't Easy. Let's talk about the policy provision that requires regular care of a doctor. Now, the initial claim process can be daunting and confusing, and I believe that you should be getting out that disability insurance policy and reading it cover to cover so you sort of have a sense of the waterfront. But today we're going to concentrate on medical issues. So let's find the policy section that talks about regular care of a doctor. Now, normally a provision will read something like, to file your disability claim, you have to prove that you're under the care of irregular care of a doctor. So the two crucial elements in this definition are regular care and doctor. And look at the definition of the disability policy of regular care. And let me give you an example of what it has been defined as. You personally visit a doctor as frequently as medically required according to generally accepted medical standards to effectively manage and treat your disabling medical condition. And you're receiving the most appropriate treatment and care which conforms to generally accepted medical standards for your disabling medical condition by a doctor whose specialty or experience is the most appropriate for your disabling condition according to generally accepted medical standards. Now, this provision, in my view, brings up a couple of issues. The first issue is, does a telehealth visit count? Well, maybe. Certainly in the age of COVID, when doctors' offices were closed, you could not personally visit a doctor, and you certainly couldn't visit them frequently. The only way that you could consult with a doctor would be by phone or actually by video conferencing. Now, there are some disability carriers who have said that's fine. There are other carriers I have who've actually denied claims on the basis that the telehealth visit didn't count. It's going to be interesting to see what the federal court does with this, because in my appeal letters, I'm citing the COVID documentation regarding the specific geographic area my client is in, the positivity rates, whether there were any orders basically for people to shelter, and all the applicable rules and regulations that have been in effect during the period of COVID. Now, as we're coming out of COVID, I am seeing more demands from disability carriers that there actually be a personal visit. So expect that. And certainly you need to be prepared to deal with that in any way that you think is appropriate. I'm not going to get into the politics of masks or vaccinations or any of that, but you need to do what you need to do to maintain your disability insurance benefits. Now, another key here is frequently as medically required to effectively manage and treat your disabling conditions. Many times, if you've had an acute injury, you're going to be seeing the doctor a lot in the beginning, but as time progresses, and your condition stabilizes, you're not going to see the doctor as frequently. Many times I will reach an agreement with the disability carrier once the claim has been accepted as to how often they want to have my clients see the doctor. Because there are times when the doctor says, you don't need to come back and see me for a year. That's probably not going to be well received by the disability carrier. So you may have to see the doctor more than that. But again, we try to hammer out an agreement with the disability carrier as to the frequency. Another issue here is the most appropriate treatment, which conforms to generally accepted medical standards. There are some of you who do not trust traditional medicine, who are use alternative treatment methods. I will be frank with you. Disability carriers do not think that alternative medical treatment is the most appropriate treatment, and they don't think it conforms to generally accepted medical standards. You have the right, certainly, to choose what type of treatment you want, but you need to understand that that can impact your disability claim. And so I like to have my clients who want alternative care to do a mixture of traditional care and alternative care with a sympathetic physician who will condone and approve this alternative care. Now, the other key words in this definition are a doctor whose specialty or expertise is the most appropriate. If you have MS, Parkinson's, the carrier is not going to be happy if you're treating with your family doctor. That's just the reality. They want to see you treat with a specialist. Same with ME/CFS, fibromyalgia, and any rheumatological condition. They want you to be treated by a specialist. So you need to understand that going in. Now, when I started this segment, I said that regular care is defined, but the other factor is the definition of doctor. Doctor can mean a person performing tasks that are within the limits of their medical license, a person with a license to practice medicine and administer drugs, and a person with a doctorate degree in psychology whose primary practice is treating patients, or a person who's legally qualified as a medical practitioner according to the law and regulations of the governing jurisdiction. Now, many disability policies, when and how, will not recognize you or your spouse or children or parents or sibling as a doctor for any claim. So you can't be treated by a relative. Again, this becomes an issue as to the nature of the medical practice. Is the doctor licensed? Are they practicing medicine within their licensure? I will tell you again that disability carriers are not necessarily wild about long-term disability claims where the treatment is by a naturopath or a naturopath, a homeopath, an acupuncturist. Those are not the kinds of claims that have long-term success, because the disability carrier, quite frankly, doesn't think that that's the right kind of doctor or that they are qualified to provide the treatment. And as I've said, this can be an issue, and it also can be an issue in a psychological claim. I've seen cases where regular care has been defined to be seeing a licensed therapist or psychologist or psychiatrist at least twice a month. I will tell you that one of the reasons psychological claims get denied is that they criticize the frequency, nature, and duration of the treatment, saying that if you were so impaired, you'd be, hospitalized, institutionalized, or you'd be, lying on the doctor's couch 7 days a week. And so regular care can be tricky depending on the nature of your medical condition. And you won't know whether or not the carrier thinks that your regular care is appropriate until after they deny the claim. So in my view, more frequently after an acute episode and tapering down to a minimum at some point of at least twice a month is appropriate. Now, again, the other issue is going to be what's appropriate care. In a psychiatric claim, disability carriers are notorious for denying a claim on the basis that the care you're receiving is not appropriate because of the lack of the testing that documents the nature of your problems or any improvement, the lack of counseling, including group therapy, the lack of counseling in combination with medications. They play lots of games with psychiatric claims. in terms of the frequency, nature, and duration of the care. Now, you also need to understand that two things here. The disability carriers are going to have your medical records reviewed by their board-certified in-house or out-house liar for hire doctors who will cherry pick the records. They're going to criticize the lack of documentation in your chart regarding the diagnosis, the treatment plan, your response to the treatment plan, the lack of aggressive measures. So issues regarding medical care can be expected, particularly in psychiatric conditions. And the other thing, excuse me, that you need to understand is that disability carriers have disability duration guidelines. They use a book that's actually written by a psychiatrist who was allegedly consulted with every kind of specialist in the world about every kind of condition in the world, and they've come up with disability duration guidelines and treatment protocols. So the carrier is going to be looking at the accepted criteria, for example, from the American Academy of Orthopedic Surgeons for treatment of hip or back issues. But they're going to be looking at these disability determination guidelines as a way to backstop and limit the period of disability based on the nature of the treatment. Whew. Wow, that's a lot of information. Let's take a break for a moment, and we're going to continue in a minute with the consequences of irregular care or no care at all.